For my project, I chose to volunteer at Weston Sunrise Living Center to gain a better understanding of the government's role in elderly health care.
Every Wednesday and Saturday, I visited with the residents. Together, we did many things such as painting, card games, creating flower arrangements, and playing board games such as Scrabble. Scrabble became a huge hit, and it was built into their schedule as a planned event. We also took numerous trips outside of the home, one of which was to the Attleboro Art Show, which can be seen in the following pictures. I loved working with the elders because of how much they were able to teach me. They were so insightful and showed such interest in all I had to say. Ed, one of the residents I worked closely with, was the editor-in-chief of Time magazine, as well as one of the original founders of the company. As a journalism student myself, we constantly had so much to talk about. Not only did he urge me to pursue my journalism career in college, but he also insisted on receiving a copy of the Wildcat Tracts so that he could read, and sometimes critique, my articles. Building a relationship so sincere in such a short amount of time was an amazing experience. Sunrise works to create an environment that the elders can transition into easily. The environment is very warm and comforting. The staff is also extremely friendly and easy to get along with. They think of the elders as family, which is evident when you see them together.
A word to describe Sunrise is passion.
Extraordinary.
Compassion. Caring. That we are definitely an organization that cares about its people. To feel the warmth of Sunrise means to me, when you walk into a community, you see the family. You see the love that's in the atmosphere. You see a smiling resident. You see a team member reaching down and touching someone.
Here we really are a big family. You know, other places might say it, but here we live it every single day.
If you struggle with anything, just pick up the phone or type an email, and your support is just one click away.
And I could call on anyone, regardless of the community, and they have the answer for me if I have a question.
The residents and the staff is all one big family. Diversity is important because, to me, it brings enrichment to any organization.
Sunrise is the best place that I've ever worked simply because of the people. This is an organization that thrives on entrepreneurship and free thinking and doing what's right for the resident, very resident-centric. And for me, that's a big breath of fresh air.
In my job, I get to go visit communities. I get to see firsthand the care that's provided. I also get to go visit competitors and see the care that's provided there. And it is completely different walking into a Sunrise community and walking into a competitor community.
One of the biggest differences is that the ability to be able to do some of the little things that get overlooked. It can be something as simple as one of the channels on my TV is not working. Is there anything that can be done about that? Yes, ma'am, we'll get to that right away.
You have the opportunity to work in a phenomenal environment with wonderful people and every day enjoy coming to work.
I have the opportunity to help and to learn as well. And that's what working with this company has allowed me to do, to change my life.
Sunrise, you're going to feel the warmth, the comfortableness of just being in the environment. And that's what makes you want to come back and do it again and again and again.
According to the United States Department of Health and Human Services, the elder population hit 39.6 million in 2009. The elderly represent 12.9% of the U.S. population, meaning about 1 in every 8 Americans are above 65 years of age. By 2030, there will be about 72.1 million elders, which is more than twice what their number was in 2000. It is also expected that by 2030, the elderly will represent 19% of the population.
The government has set up a series of programs in an effort to make sure the elderly population is protected. A notable one is Medicare. Medicare is the federal health insurance program for people who are 65 years of age or older. Certain young people with disabilities and people with end-stage renal disease also qualify.
Here is a YouTube clip going into a bit more detail on Medicare, which is focused more directly on the elderly.
we wanted to explain a little bit more about what goes into Medicare and why it's important, what the important distinctions are. So Medicare is a federal system of health insurance. You get this taken out of your paycheck every month. You pay for it. Eventually, when you turn 65 years or older, you get this type of medical coverage. And there's two main parts that go into Medicare: Medicare Part A and Part B. We're going to talk about Medicare Part A first. So what is Part A? This is what your taxes pay for. If you pay at least 10 years worth of Social Security and related taxes, you get this for free when you turn 65 or older. It helps cover hospital stays. That's the important part. Medicare Part A equals hospitals. Then there's Medicare Part B, which is the medical insurance part that covers things like doctor's visits. So Part B equals doctor's visits, and you pay a premium for this. So it gets deducted from, say, your Social Security check, and that's the important part, Mark. So those are the two main parts of Medicare.
As you can see, Medicare has had a huge impact on the senior citizens because of how it directly addresses issues they face every day. When Medicare was originally introduced, chaos followed, as we commonly see when any plan requiring money is set into motion in the United States. But Obama stood by it strongly and addressed the issues nationally. Today, he still sticks to those same values.
Hi, everybody. Over the last few weeks, there's been a lot of talk about Medicare, with a lot of accusations and misinformation flying around. So today I want to step back for a minute and share with you some actual facts and news about the program. This week we found out that thanks to the healthcare law we passed, nearly 5.4 million seniors with Medicare have saved over $4.1 billion on prescription drugs. That's an average of more than $700 per person. And this year alone, 18 million seniors with Medicare have taken advantage of preventive care benefits like mammograms or other cancer screenings that now come at no extra cost. That's progress. It means that seniors everywhere are getting the care they need for less. If you have questions about what benefits you're entitled to, you can go to www.medicare.gov to find out. This news is also a reminder of what's really at stake when we talk about the future of Medicare. It's not about overheated rhetoric at election time. It's about a promise this country made to our seniors. It says if you put in a lifetime of hard work, you shouldn't lose your home or your life savings just because you get sick. Over the last 47 years, millions of Americans have worked for that promise. They've earned it. And for many seniors, the care they've gotten through Medicare has made all the difference in the world. Growing up as the son of a single mom, I was raised with the help of my grandparents. So I saw how important things like Medicare and Social Security were in their lives. And I saw the peace of mind it gave them. That's why, as president, my goal has been to strengthen these programs now and preserve them for future generations. Because today's seniors deserve that same peace of mind. Millions of Americans who are working hard right now deserve to know that the care they need will be available when they need it. That's why, as part of the Affordable Care Act, we gave seniors deeper discounts on prescription drugs and made sure preventive care like mammograms are free without a copay. We've extended the life of Medicare by almost a decade, and I've proposed reforms that will save Medicare money by getting rid of wasteful spending in the healthcare system and reining in insurance companies. Reforms that won't touch your guaranteed Medicare benefits, not by a single dime.
During my time at Sunrise, I was given the opportunity to build friendships with some of the most influential people I've ever met. Everybody had a story to tell and advice to give. My advisor, Robin, was unbelievably helpful to me throughout the entire process and provided me with everything I needed to get a better insight into how the government support plans such as Medicare and the Affordable Health Care Act actually worked and affected